Your doctor has prescribed a VertAlign back brace called a TLSO to help you recover from your back injury or spinal surgical procedure. Your fitter has chosen the proper components to fit your gender, specific body shape, and medical needs. The fitting process usually takes about 30 minutes and should include any family members or caregivers available. Your fitter will instruct you on application, wearing, and removing your brace. Your fitter may provide you with a list of supplier standards required by Medicare and other payors. Carefully read these standards, and if you have any difficulty understanding any of these standards, or if you require them in a language other than English, please inform your fitter or provider immediately of the difficulty. You will be asked if you understand these standards and have any questions. A positive response is required. This video will explain each type of VertAlign brace, but your doctor and fitter will determine which variation will work best for your condition. It will assist you on how to apply your new back brace in various situations, what limitations the brace will place on your activities, and how to perform certain activities in your brace, depending on your doctor's instructions. This video will also cover how to remove your brace, clean both the shell and the liners, and how to overcome any difficulties that may arise. Your doctor will advise you on getting out of bed with or without your brace, depending on your condition and how stable you are from your injury or procedure. First, apply a cotton tee or undershirt while lying in bed. Never place your brace directly next to your skin, even if it is fully lined. If you are allowed to apply your brace standing, carefully arise and stand with your back against a solid wall, door, or door frame, with the back shell against your back and aligned as instructed. Make sure the arrow on the back shell points toward your head, and the front shell is free to swing over your chest. The hard surface will support you and hold the back of the brace in place. This will allow both your hands freedom to fasten the front shell across your chest and stomach. Do not separate your front and back shells, as your fitter will have adjusted them for your size and body shape. Now, place the middle Velcro strap through the middle loop on the front of the brace and tighten, making sure the side panels pass under the front shell. Fasten the middle strap firmly and check the position of the front and back shells to be certain they are in the proper position. The front shell window should be about 3 to 4 fingers, no less than 2 finger widths below your sternal notch when sitting. Then fasten the bottom and top straps. Check the middle strap and retighten as necessary. Now you may apply your trousers and outer garments. You may be required to apply your brace while in bed. First, make sure the arrow on the back shell points toward your head. Then roll to the side on which your brace opens. Roll or slide onto the back shell so it is positioned to cradle your spine. Now, roll onto your back, being careful not to twist at the waist. Position the front shell over your chest and place the middle Velcro strap through the middle loop on the front of the brace and tighten, making sure the side panels pass under the front shell. Fasten the middle strap firmly. Then fasten the bottom and top straps. Check the middle strap and retighten as necessary. Remember, do not over-tighten your brace. It may feel better short-term, but could cause circulation problems long-term. Now, roll onto your side and push erect. Your brace will feel tighter when you sit up at bedside. Reposition and adjust your brace if necessary. Care should be taken to avoid tightening your brace to the point where it restricts your breathing, and you should be able to insert an index finger under the support edges. When dressing, we suggest an elastic waistband be used for comfort and convenience. Your fitter will perform a checkout procedure while you are in your brace to see if you can sit on a firm chair with arms, perform your own personal hygiene on the toilet, as well as applying and removing your own brace. If any of these functions presents a problem, your fitter will inform your physician to arrange training, equipment, and assistance for you. Your fitter may request your return 1 to 2 weeks for a recheck on your progress. Under any circumstance, if you have any difficulty with your brace, call your provider immediately. Your brace will limit some of your motions and movement, as it should. Don't fight these restrictions. They are a normal part of wearing a brace. Don't overdo your activities. Take rest breaks often. Normally, several days are required to become accustomed to wearing a brace. When removing your VertAlign while standing, place your back against a wall or hard surface and loosen the straps on the side you feel most comfortable with or as instructed. Don't drop it. If lying down, loosen the straps and roll out of the back shell. Store your brace within reach, but unfastened to permit the liners to air out. Cleaning your VertAlign brace will prevent body odors from building up in the foam liners. First, after noting the location, remove the liners from the molded shells, using care to detach them from the Velcro tabs. The liners may be washed in a sink using mild soap and rinsing well. Rolling the liners in a towel and squeezing will speed drying. Alternatively, you may place the liners in a laundry bag and wash in a machine on gentle cycle. Liners may also be dried in a dryer on air only or no heat cycles, just tumble dry. The molded shells are cleaned with a cloth and mild soap. Dry carefully with a cloth and reassemble as before. Thank you for your attention to our VertAlign patient instructional video. The Bremer Group has been embracing excellence for almost 20 years with comprehensive back brace solutions. We hope our brace gives you both comfort and relief. If we have not answered all of your questions regarding your VertAlign, please call our customer service at 1-800-428-2304 or visit us on the web at bremergroup.com.